number of people suffering head and neck cancer is rising in the Philippines. So what are the symptoms and causes of this ailment? Well,
to find out, joining us now are Dr. Ricardo Fernandez, chairman of the ENT Head and Neck Surgery at the Makati Medical Center, Dr. Ramon Juan Osiaco, training officer at the Head and Neck Surgery Department, and Cherry Miguel, head proponent of the Run Doctor Run event. Good morning, doctors and
Hi,
Cherry.
good morning.
Hello.
morning.
Thank you for joining us.
Yeah.
Now, I mean, numbers are on the rise with head and neck cancer. I think it seems to be, I mean, from an outsider perspective, one of the cancers that don't necessarily get as much attention or highlight or focus put on it. Tell us about head and neck cancer and really why there is that rise.
Well, of course, it's because as we get more industrialized, we get a lot of exposure on pollutants and free radicals. So problem is those who are not educated enough to know the value of anti-radicals and keeping away from exposure to pollutants, like, you know, when you're driving a motorcycle all the time and stuff like that, or when you work in chemical factories, they start to go into your sinuses. They can cause mutations, and if they have, if they're educated enough to, or if they are trained or taught how to avoid prolonged exposure, like wearing a mask or doing nasal washing, or even just regular checkups with your local doctors.
So this is typically things that you inhale and you ingest.
Yeah, some of them, yes, there are risk factors. Like, for example, smoke, the pollution outside, they say some chemicals. But there are some cancers also that you don't know why they grow. There could be theories, but you can't determine why they grow until now.
Okay, so it's just one of those unexplained things. That
family predilections. You know, like if
Yes,
you have a
also.
family history or your genes are
Genetics.
predisposed to that.
Right.
Doctors, is it also possible that the symptoms of head and neck cancer are quite common? I mean, we was kind of reading through some of the symptoms that people might get if they are at risk for head or neck cancer, and that's a sore throat that doesn't seem to go away. You've got other symptoms like I guess a cough. Maybe these things can be mistaken for, oh, this is just, you know, your normal. I'm sick. I'm coming down with something.
When do you know when to draw it? Because I've had a sore throat for a while now.
I've had one for a week, and now I've had one top.
When should you start to be worried, and when should you start to seek help or consult with doctors when you feel like, teka, parang this has been a while already? When do you draw the line?
Well, for example, there's like a neck mass that grows. It's not painful, or even if it's painful, better you show it instead.
Okay.
Swollen red, but if not, usually they're quiet. There's a tumor. It's just like a tumor that just grows slowly and it's painless. Then it might be also a form of cancer.
So
but
any type of growth is something to be
consulted.
concerned about.
Yes.
Yes, growth. No, another also. Well, let's say for example, the symptoms are you're coughing, and then later coughing blood. It can be other causes like tuberculosis, etc. But there might be a tumor there in the entrance of your lungs, the vocal cords. The tumor there is the one that easily bleeds. That's why you cough and you have hoarseness. Then it better be checked. So long-standing, maybe after 2 days you have symptoms, better have it checked. If it's an infection, then it can be treated. But if not, it can be investigated.
Doctors, there are certain cancers that you know, we hear of when it is early detected, or is detected early rather. There is a high percentage of it being cured and treated.
Yes.
Head and neck cancer. Tell us about the curability of this.
Well, if you catch it early, then it can be removed locally without too much damage to surrounding structures. Also, if we know what kind of cancer it is, some of them are curable just through radiation or chemotherapy. But if you don't have a consultation and you don't know what's going on, this is when it can grow and spread, and then you'll have a harder time removing it entirely. Because if you don't do a curative surgery in the first attempt, it's very hard to completely remove all the tumors that have spread throughout the lymph nodes and other areas of the body.
Like there's some cancers, for example, you catch it at a certain stage. Well, according to let's say this certain disease, you catch it at this stage. It's not yet around the body, and you do this certain protocol. You might have a better chance of getting cured. And there's some cancers that you do it you get a cure, a stronger chance of cure. No matter what cancer, is not a guarantee, but there are some cancers that when it comes out, it's this kind of name, it's a bad kind of cancer, hope for the best. But there are some cancers, you treat it this way with the protocol, with whatever stages, as long as it's not spread out, then you also can have a good chance of cure.
All right.
No?
In terms of treatments and cures and that sort of thing, is there anything that is different or more specific to head and neck cancers that doesn't apply or perhaps is unique to head and neck cancer?
Well, what's good with present-day technology is we have these endoscopes, and they're like filaments or they're like small snakes with a camera at the end, no?
Oh, I've seen those in the movies where they just take this.
We can go inside your nostril and go all the way up to the vocal cords and look at every nook and cranny. And so if we see something that's suspicious, we can do a biopsy and then we can tell what's going on.
How often should people have regular consultations with an ENT?
Oh, every day. No, I'm just kidding. I'm just kidding. I'm just kidding. No, what I mean is, okay, a common cold is supposed to last only 2 weeks, 2 to 3 weeks maximum. So if you have symptoms that last for a month or 2 months, you should have a checkup. It could just be allergies, but it's always healthy to ask the doctor his opinion, and he'll give it to you from what he knows, and you'll be more educated as to what to expect if you're supposed to be healthy and what to avoid if you want to stay healthy.
Well, we saw some of the major causes of head and neck cancer, and that's alcohol and smoking, tobacco use and alcohol. Now, I think a lot of times people kind of correlate kidney problems with alcohol or lung cancer when it comes to smoking, but now, I mean, very much so we're learning it can also affect your chances of getting head and neck cancer.
Cancers, yes. The laryngeal cancer, the voice cancer, that's the one they come in maybe having a hard time breathing. So they have this stridor, they have a hard time breathing, then their voice is hoarse, then they start coughing also blood. So maybe with the endoscope, as what Dr. Ricky would say, you take a look and you find out there's a tumor there, you have to take a bite. Now if the stage is early, then you can do an operation like a laryngectomy. Remove the voice, they breathe here, but you create something so that they can have their own new voice.
Okay.
Reconstructed. And also later other treatments like radiation. So you're hoping that you're going to get cure as long as it's not spread around.
I see.
But I mean, that commonly occurs when we talk about head and neck. I mean, oftentimes we're talking about mouth, gums, tongue, the back of the throat, you were saying, and such.
Yes, basically that's the head and neck area, like the parotid glands, the nose, the sinuses, the throat area, the throat below, the tonsils also, and also the neck.
Well, we've got a lot of questions. I mean, it's wonderful that you guys are actually going to have a fun run that will also highlight and spread some information about head and neck cancer. Cherry, tell us about the fun run that's coming up.
We're going to have a fun run on August the 28th at the Dasmariñas Village, Makati City, 5:30 a.m. Sunday. And it's actually for the benefit of head and neck cancer patients, especially the indigent patients of Makati. We have a 10K, 5K, 3K, and 1.5K. And the it's a fun walk, actually.
It's a fun walk,
yes.
all right. So no pressure to run. We can always just start walking, right?
Correct. And we have the registration centers, actually. ENT Diagnostic Center, Makati Medical Center, 2nd floor, Tower 2, number 2, Amorsolo Street, Makati City, 8888-999, local 3210. Rocks, Recreational Outdoor Exchange, Bonifacio High Street, Fort Global City, and Air Runner Circle, Unit H, Aloha Hotel, 2150 Rose Boulevard, Quirino Avenue, Malate, Manila.
All right, good stuff. Well, this is certainly something that we can all be doing to support the cause, and I suppose staying healthy is one important way to make sure that you stay out of the way of cancers and such. I mean, I hate to say. What is it? The old saying, an apple a day. I guess the old story really is stay healthy and you'll keep the doctor away. Sorry, docs. But sorry, docs. But yeah, stay.
If these people don't have the money for the initial diagnostic checkup, how can we expect them to have the money for the treatment?
Because we're doing this for indigent Makati patients.
So we're trying to raise funds.
This is certainly one way that we can all pitch in.
What is the, I guess, the piece of the pie of people really with head or neck cancer? I mean, is it? We did say that the numbers are rising or that they are growing, but at this point, I
Is there
guess
a
what percentage?
statistic?
Yeah, what percentage of the population, or how many people are you looking to help
No, it's
out?
not. It's not really so big usually, but they come from time to time. Figures I
And
cannot
it's
say. Right.
geographic also.
Also,
And
yes.
as you were saying, I mean, the intake of pollution, the intake of, I mean, we
Yes.
do see that maybe more prevalent in certain socioeconomic classes, and maybe in those socioeconomic classes
Yes,
are not
because
able to
lung
treat.
cancer is from cigarettes usually,
Yeah.
but tobacco is
Right.
usually the oral cancer, which is head and
See.
neck.
You can expect an increase of thyroid cancer rate in Japan because of the radiation. So it's also geographic.
All right. Well, I think it's wonderful that you guys are having this fun run or fun walk for for the patients that aren't able to finance or to fund their. Thank you so much, doctors.
Thank you
Jerry,
very much.
Thank you.
Thank
Dr.
you.
Thank you.
Thank you very
It was a
much.
pleasure.